In this unit, we're going to be covering the basic procedures for drug addiction counseling. So the goal of this unit is to help you to understand the basic procedures of drug addiction counseling. The objectives here are for you to be able to list the counseling procedures, explain the interactions between the various steps of the procedures, practice providing counseling sessions through role plays according to those counseling procedures, and then apply goal setting and problem solving techniques in those role plays. So let's talk about building an alliance with your client. This is going to be crucial to your success or to the success of any counseling program. In drug addiction counseling, we call this a therapeutic alliance. The counselor should create a sense of participation in collaboration and partnership. There are three key ways to develop this collaboration and partnership. First, the counselor should possess a thorough knowledge of addiction and the consequences of drug use. Second, no matter how experienced the counselor is, they have to acknowledge that the client is the true expert in discussing their own life. The counselor has to listen intently, effectively, and avoid passing any judgment. And this is going to be difficult for a lot of counselors. Some people like to act as a parent does with their child. But when you're a counselor, you're talking to another adult, and adults have more cognizant capability to understand how their behaviors lead to certain consequences. And then third, the counselor should convey to their clients that they're an ally in this difficult process, and they're there to help them achieve their goals. So, drug addiction counseling with individuals and groups is a dynamic and circular process. There are 7 steps to this process. And the first step is to have an initial introductory meeting with the client. In the initial moments of the first session, the client's likely to be nervous and cautious about who you are and whether or not they should really trust you. And even if you try your best, the trust between the client and the counselor is going to take some time to develop. But it is important that they see you as someone who treats them with respect and dignity before you begin the counseling process. This counseling process is a loop. It starts with assessment of the biological and the psychosocial needs of the client. You're going to want to be able to understand the multidimensional issues of drug use as it relates to your clients. You are going to often assess individuals on their health, their education, their employment, their alcohol and drug use, their family and their social life, their legal and their emotional background. And this assessment is going to lay the foundation for the next series of steps and future sessions that you are going to have with your client. So as we're progressing through this unit, we're going to discuss each of the issues that are related to the holistic and circular nature of the steps in the counseling procedure. The counseling process is not this linear process where there's a clearly delineated finale. So as it's depicted in the slide, this process is circular. You start with the assessment, and then problem solving, goal setting, and development of an action plan. Then you proceed with revising the plan and summarizing the activities, and then beginning again with a new assessment. And this is performed over time, but not at every counseling session. Hence, it's an ongoing process, and as some problems get resolved, others are likely to emerge. So I want you to take the next 35 minutes to brainstorm what is involved in each of these steps. And I want you to write them down on your own sheet of paper. So take about 5 minutes for each step to really brainstorm for that particular step. Feel free to pause the video here to complete this step. So taking into consideration all of the attributes of good counseling, The first meeting with your client should include a self-introduction. You want to tell your client your name and your position and your role within the organization. You want to introduce services. Tell the client about the services that are provided at your organization and which services you provide. And if your organization has linkages to other organizations, it might be helpful to explain those as well. And you want to explain confidentiality. A lot of clients are going to be concerned about information that they tell you about their drug use. So it's going to be particularly important that they're aware that the service you provide is confidential. And I cover confidentiality in another course that I offer. And also what the parameters of that confidentiality are. And then time management for the counseling session. You want to make it clear that there's a defined time frame for the session and that starting on time and ending on time are important in order to respect the time allotted for each client. You want to explain your reasons for collecting the client's information for the first-time clients, or for returning clients, you want to explain the objectives of the sessions. And it's important to tell them that you're going to ask them a lot of information so that you can understand more about their problems and help them to work out the best solutions. So counseling and treatment entry assessments require a relatively comprehensive assessment of a client's condition and specific problems and needs and issues, including their health, their psychological and social background. We call this a biological psychosocial assessment or evaluation, or as it's more commonly referred to, a biopsychosocial assessment. So the counselor is going to be responsible for completing this biopsychosocial assessment in conjunction with gathering a client history in the very first or second sessions. Assessment typically is going to examine the client's drug use and their related problems over the past 30 days, and it could even go back for the past year or even lifetime use. It must be completed when the client enters treatment to establish a baseline and to identify any areas of need, and then at selected follow-up sessions thereafter to measure the change. So assessment should generally focus on drug use, alcohol use, health problems, psychological problems, financial problems, legal problems, family or social problems, and employment or any support systems. So it typically requires about 45 minutes for the initial assessment and maybe about 25 to 30 minutes for each follow-up assessment. So demographic and psychosocial information, this is going to be their age, their gender, education level, marital status, who the client lives with, is there an existence of a support network, what is their income, how do they receive their income, what's their job. And it's also important because it's going to help you to understand the client's problems and the available resources for responding to those problems. We want to look at those protective factors. And then once the client assessment is completed, the client and the counselor should identify the main topics that they want to address and prioritize those topics, because not all issues can be covered in the first session. So the prioritization of these problems might change over time. So it's going to be helpful to develop a working problem list that you can revisit at the beginning of each counseling session to see whether or not a specific problem persists and to what degree your client is concerned about that problem. And clients often enter treatment pretty ambivalent about how much they want to give up their drug use. And counseling begins with helping the client decide to participate in treatment and to set realistic goals. So for example, reducing risk from drug use or learning to abstain from drug use. The counselor can help the client recognize and understand the damaging effects of addiction and develop motivation to recover. So in this progressive treatment model, the client's ambivalence is discussed specifically in the first 2 weeks of treatment, although motivation and commitment to recovery may be some recurring topics to be discussed throughout treatment. And we're going to address the stage of change theory and motivational interviewing approaches to assist in addressing this ambivalence in my motivational interviewing course, which you can find on our website. So you should devote those first 2 sessions of counseling to introducing that treatment program to your client. We want to obtain a drug usage and treatment history. And we also want to develop a treatment plan with your client. And then in addition to setting up the framework for counseling and treatment, the first 2 sessions are important in fostering client motivation to set goals. It's not uncommon to face ambivalence and denial in the early phase of treatment because they're fundamental roadblocks to recovery. Counselors have to discuss them in the first 2 sessions and throughout the treatment process as needed. An assessment doesn't only happen once. At the beginning of each session, counselors should inquire how things have been going since the last session and whether the client has used any drugs. Any drug use should be noted. If the client has relapsed, the client and counselor should analyze the relapse, determine what precipitated it, and develop any alternatives that can be used to avoid relapsing again. And this process is probably going to require the full session. If the client presents with maybe an urgent addiction-related problem, like a family argument or a financial problem as a result of their addiction, the counselor should address these problems in the session. An emphasis should be placed on how these problems are related to the addictive behavior. The counselor's goal is to really help the client develop strategies for dealing with problems without turning to drugs. So, for example, the loss of someone's job or severe relationship problems is going to require acknowledgement and some attention in the counseling session. However, the main purpose of the session is to reduce risk associated with drug use and the promotion of recovery from addiction, not the resolution of the client's other life problems. And if there's no urgent problems, then you can begin a discussion with your client. And we want to follow the problem-solving steps. We want to determine challenges. So as a counselor, it's important to give your client a chance to think these through. Don't act immediately. We want to specify problems. And the greater the specificity, the easier it is to brainstorm solutions and come up with a mechanism for resolving the problem. We also want to teach brainstorming solutions. In brainstorming, you can come up with as many solutions as possible and write them all down. And don't reject any ideas or try to just think of the best idea. We want to think of all the possibilities, even ideas that are clearly impractical or not possible, because they might have elements that are useful. And then we want to decide on appropriate solutions. So we want to develop a short list and think of the pros and cons of each solution. Is it realistic and practical? And we want to develop some problem-solving plans. Develop a plan of action. And this might even require role-playing with the client. When the counselor and the client are clear on the problems and the possible solutions for these problems, they can move on to setting short-term goals. And these short-term goals should be SMART goals. Remember I said it was specific, measurable, achievable, or agreed, something that's achievable that's agreed on by both the client and the clinician. And then the R stands for realistic, and the T is for time-bound. So your clients can be classified in terms of their preparedness to change. And I discussed the stages of change in a different course, but just note that it helps if the goal that you set with your clients is matched to their stage of change. And short-term goals are most easily determined when an individual is in the action phase. This is when they're just working their plan. And goals that are in the action-oriented phase require people to be in the action stage. And if they're still in the contemplation phase, their goals may not be action-oriented because they're still just thinking about, do I want to quit or do I not want to quit? So by the second session, the counselor should finish the biopsychosocial assessment if needed, and then develop a treatment or an action plan in collaboration with the client. The action plan should identify the problems to be addressed in treatment and also the desired goals. So counselors should really try to ensure that the primary problems identified are the risks associated with drug use and addiction. Other problems should be addiction related. The initial treatment plan is going to be basic. Its purpose is to clarify the mutually agreed upon goals of the client and the counselor, with the client making a commitment to work toward recovery. And the counselor should inquire about the client's experience with social support groups and ask whether the client already attends meetings, has maybe previously attended but no longer attends, or maybe they've never attended them. And if they're unfamiliar with social support groups, the counselor should briefly introduce the client to the group counseling approach and provide a list of where sessions are conducted in the area. And all clients should really be encouraged to attend meetings as often as it is possible as part of their recovery plan. And if it's agreed to, participation in social support groups should be listed on the treatment plan. So once you've selected one or two realistic and achievable goals, you then need to define these clearly. We want to be precise in defining the goals. Put in dates, times, amounts so that you can measure achievement. And we want to divide each goal into smaller steps that are also precise. And these steps should be ones that you can attain in a short period of time, either over days or weeks, whatever. And then we want to identify the client's willingness to change on a scale from 1 to 5 or 1 to 10 and rate their confidence in their capacity to change on that same scale. So following completion of the active treatment counseling plan, clients might benefit from reviewing and revising their original plans as necessary. And this is best done by summarizing your jointly agreed upon goals and strategies that are supposed to be implemented and following up in coming sessions. And this is going to help you to focus attention on the strengths and the available resources to assist the client to begin that behavior change. And it can also assist clients to maintain their commitment. The subject matter that's discussed in the follow-up sessions should really continue to be addiction related. These are going to often involve the repetition of earlier topics with a new and a higher level of understanding and integration. So clients who have recently stopped drug use might have difficulty understanding and retaining that new information. So it's not unusual to need to revisit and discuss the issue many times. So the goal of plan revision includes to provide a reminder to the client of their commitment to treatment, to offer support and feedback, to help the individual to develop a personal treatment program, and also to be available if relapse or a similar crisis should arise. The final component in the counseling process is the summarization of activities and the client's progress. And this really needs to be done at the end of each session. So summarization is just a really effective way to close the session. You review with your clients what you've discussed and agreed to, and also the way to move forward. And it's also a way to assess their confidence and their commitment to do something, that we've agreed to. So the question here is, do you think confidence and commitment are the same thing? And I've actually included a YouTube video in the lesson that discusses confidence and commitment that you can actually look at for further discussion on this. But having confidence really just means believing in your own capability to perform a task. Do I believe that I can do it? And commitment is, to what degree are you willing to take action? So therefore, at the end of each session, we need to be doing the following things: summarizing the topics and the outcomes of the session, determining your client's confidence to implement the plan as agreed upon, determining your client's commitment to implementing your plan, confirming the time for the next session, and we want to make sure that we're recording notes in our counseling logbook. I've also included a short video in this lesson about the importance of documentation for your review. That video is discussing documentation in the healthcare field in general, but there are a few reasons why documentation in our field is really vitally important. Because one, at the end of the day, the records are going to assist you to note things that worked well in your sessions and the things that you may wish to improve upon or address in subsequent sessions, or maybe things that you've missed. And then two, before you see the client, you might want to refresh your memory so you don't waste any time asking them the things that you already know. And in addition to that, if you review before your session, you're already going to be engaged before you begin your session. And then the third reason is drug users often feel that they achieve little or nothing. So by keeping a record of the things that your client has agreed to accomplish, and by noting those accomplishments, you can refer that client to their record to see how much they have achieved over the course of their counseling and treatment. This is going to give your clients the courage to continue. And then summarization. Actually, let's go back. With documentation, it's vitally important. I'll add a fourth point here. It's important because if you don't write it down, legally it didn't happen. So we need to cover our own selves and make sure that we're writing down that the client showed up. What were they doing? What did they say? What was their behavior? What interventions did you use? You want to make sure that you're covering yourself as well. So summarization, or what we might be called the evaluation of progress, is really an opportunity to reintroduce issues and topics that might still need to be addressed. And it's at this point that you and your clients really establish new goals and action plans to encourage new progress. And this is going to be a good place to begin the counseling cycle anew, as referenced in that cyclic diagram. And this is going to include discussion of the counseling procedures and some of the issues and the areas that you face. And while there are a few more presentation slides before we begin our role plays, I would like to suggest that you take a 10-minute break to refresh yourself before we move on. So go ahead and take that 10-minute break now. Feel free to pause the video while you take your break. So before you conduct your role plays, I would like to provide you with a few important tips that are going to help you to manage your sessions effectively. First, we got to be sure to use our time wisely during our counseling sessions. We want to stay focused on the key issues, but be sure not to push your client to move faster than they want to move. And repeatedly remind your clients of the objectives of the counseling session as necessary. Sometimes some clients get distracted and they go off in directions that have very little to do with the goals of the session. So generally, you're going to need to remind your clients of the purpose of the counseling session. And you want to focus on your client's most important or urgent problem or problems. Your client may have health or social, legal, financial, family, or vocational problems, but you're going to need to keep focused on what's most important for them. And we also want to respect our clients' choices and decisions, but you should not agree to things that are unsafe or illegal. And we want to keep records of the content of your counseling sessions for follow-up. We want to summarize the main points that are discussed, including progress made during the current and the previous sessions. And we also want to set up time for the next counseling session with your client before they leave. So counselors adopt an active listening approach. And as we discussed previously, counselors should really draw logical conclusions from the information the client gives in relation to their substance use and the related problems. And those connections may not be obvious to the clients themselves. When an issue has been explored to a logical conclusion, the counselor should change topics and move on to the next issue. Discussion should remain oriented towards the problems associated with substance use. And summarization should be used to draw together significant points and reinterpret them in a way that makes sense to the client. So I just want to discuss a few key points about the counselor role. And you can also refer to the handout in the lesson 2.6-1 for more information. But the counselor's primary role is to elicit and consolidate the client's motivations for change. This facilitator role includes being a collaborator in the recovery process. The client should do about 90% of the talking, except during the personal assessment feedback when the counselor has a substantial explanatory role. And also, sessions should be client-centered but directive. The counselor pursues a specific objective or maybe a set of objectives systematically, having assessed the client's issues and their needs. And when this is done successfully, the client shouldn't feel directed or coerced or advised. Direction is typically accomplished through our use of open-ended questions and selective reflection of client material, rather than through the more confrontational strategies and advice giving. So, to use a metaphor, the client and the counselor are working on a puzzle together. And rather than putting the pieces in place while the client watches, the counselor really just helps to construct the frame and then puts the pieces on the table for the client to piece together. And in the early stages of counseling, it's really important to establish a therapeutic alliance. The basic elements of client-centered therapy provide a strong foundation with a particular emphasis on the use of open-ended questions and reflective listening. And these supportive and motivation building strategies are employed until resistance abates and the client shows indication that they are prepared to discuss change. So now that you have a good sense of the procedures, it's going to be helpful to discuss how you can keep the session moving along and directed. So this slide shows how combining counseling skills and techniques together can help your sessions be more focused and directive. Whether you're working on problem solving, goal setting, relapse prevention, or managing cravings, these are the things that you're going to use to make your counseling sessions successful. So, how does a counselor work with their clients and keep things timely and not rushed? Well, you can accomplish this by combining some of these counseling skills that we've talked about. Open or closed-ended questions, probing, affirmations, interpreting, summarizing, emotional reflecting, empathizing with other counseling skills. So with the variety of counseling techniques that you've learned in this course, you're going to be able to do that. And successful combination of these skills and techniques are going to result in the client feeling heard, or the client feeling that they're part of the conversation and not just being talked to. And you're going to get links between thoughts and actions and behaviors, and that's going to become more clear to the client. And use of these techniques and skills in a 45-minute session is going to ensure that the client feels welcome, they feel understood and supported, and most importantly, that the session begins and ends on time. And by using these techniques and skills, you're really guiding the conversation and effectively managing the time of the session. So each counseling session has a start, a middle, and an end. In the beginning, you may end up talking a bit more, than the client does to provide an introduction to the services at your organization and the objectives of the counseling process. But soon you're going to be working on problem solving and goal setting and prioritization. And at this point, your client will be doing most of the talking. Then you're going to provide a summary of the session. And that's when you're going to do a majority of the talking. So you can kind of think of counseling like a sandwich, where your opening and closing remarks are like two pieces of bread, and the meat in between is the substance of the session that's provided by the client. So before we practice some exercises to see what you've learned, let's review. The counseling process has distinct steps that follow a circular pathway. After the initial introduction and orientation of the services that are provided, the counselor should undertake an assessment to identify any problems to which there are potential solutions. After problem solving, the counselor should then work together with their client on goal setting and prioritize a course of action. Summarizing the session is going to provide an opportunity for further revisions or modifications in the light of any unforeseen problems. Then the process can be continued at the next session by undertaking further assessment and evaluation. Remember, it's important to establish and maintain a close therapeutic alliance with your client to achieve results. The counselor is there to coach the client on issues and concerns that they have in relation to their substance use and other related risks. In order to ensure that the process moves forward, the counselor should ensure that they're regularly summarizing and reviewing progress and setting new goals with their clients. So now that we've had the opportunity to review the procedures, the skills, and the techniques and tips for effective counseling, let's do a role play to practice what you've learned. You're going to grab a partner and read the scenario on the slide. You're then going to be the counselor, and your client's going to be Joe. So you can take 30 minutes now to practice this role play with your partner. If you cannot find a partner to practice with, I provided a sample of a cognitive behavioral therapy session that's treating a client for heroin addiction in the lesson for you to review. And you can find more information on the role play in handout 2.6-2 in the lesson. But the role is Joe likes to go to the local bar after work. He says that drinking beer never gets him into trouble. Rather, he only has a problem with heroin. He enjoys socializing at the neighborhood bar and typically only has a couple of beers and then goes home to his wife. However, after pressing Joe, the counselor finds out that when Joe gets heroin, he gets it from a contact at the bar. It's usually on the weekends when he typically drinks more heavily than he does on weeknights, and then he meets up with his contact and they go and buy heroin. Joe is primarily a binge user, and in these binges, he often spends $500, which is a habit that he cannot afford. I've also included in the lesson another YouTube video, which you can see posted here. It won't play during this video, but you can play it in the lesson, and this is about getting into the field of addiction counseling. So in summary, doing this unit, we focused on the following: the standard addiction counseling procedures, the relationship between each of the steps in the procedures, practicing the provision of counseling according to the counseling procedures through role plays, and applying goal setting and problem solving techniques in role plays. So this concludes this unit on counseling procedures. I hope that you will all spend some time practicing the skills that you've learned today in your clinical practice, and give yourself a pat on the back. So to complete this course, you need to complete the course survey and the quiz in the completion lesson. You need to receive a passing grade of 70% or higher in order to receive your completion certificate. And I just want to thank you for choosing Georgia Reentry Center for your training needs. Please feel free to look on our website at some of the other courses that we offer.